Jai Hind friends, welcome to the Royals Education. This video is about 4 stages of COVID-19, that is coronavirus disease 19, and the 5 ways to kick this deadly disease out and keep yourself, your family and the country safe. Because the government is at full throttle to keep you safe, and as the biggest measure, the government has put complete lockdown in the country from midnight of 24th March 20 for the next 21 days. So why this harsh measure our government has taken? It is just to keep you safe and to understand the fruitfulness of government lockdown measures. Let's have a view on COVID-19 data worldwide. So I will tell you that there are a total of 3,91,947 coronavirus cases as on 24th March 20, and whatever data I give you now is as on 24th March 20. And there have been total of 17,138 people who are dead and 1,02,843 people recovered. Active cases are 2,71,966, out of which 4%, that is 12,156 people are actually serious or critical, and 2,59,810 people, that is 96% people, are in mild condition. I will tell you about the closed cases. That is, there are a total of 1,19,981 closed cases. That means the people have either recovered and discharged or they are dead. So there are a total of 14% of 1,19,981, means that is total of 17,138 people who have dead, means who actually died because of this. And there are a total of 1,02,843 people, 43, that is actually of 86% people of total active cases have actually recovered and discharged. Thus, this COVID-19 disease was actually originated from Wuhan city of China, and that too in last of December 19. And the virus which causes this disease is called SARS-CoV-2. Why SARS-CoV-2? Because the SARS-CoV-1 was also originated in China in the year 2003, and it was more deadly, but it was infecting the people in means not that much fast. So let us see that in China that there are a total of 81,171 people who have been confirmed coronavirus cases, out of which 3,277 people have died. People are saying that there are no new cases in China, but still there is 78 cases. And there have been total of 7 deaths as on 24th, 7 deaths, new deaths you may say, on 24th March 20. In Italy, even this is in news that the epicenter of this COVID-19 has shifted from China to Italy. Why it is so? You can see the data here that though the number of the infected people in Italy is lesser than what is there in China, it is only 63,927 as compared to China, but the total deaths because of it is totally double what is there in China. So there are a total of 6,077 people have died in Italy. So it is very much confirmed that epicenter is shifted from China to the Europe, and that too particularly in Italy. In India, if I talk about my country, there are a total of 511 cases as on 24th March 20 and 12 new cases, and total of 10 deaths unfortunately is there in India. And if I talk about the coronavirus incubation period, so the WHO in 180 countries, it has found that the total of means the incubation period is 2 to 14 days. That means if you are exposed to the virus for the first day, you may or you may not show the symptoms of the coronavirus disease 19, but between 2 to 14 days you may start showing it. And even in recent case, it has been found that incubation period is 0 to 27 days as long as. So keeping in view the maximum incubation period of 27 days, government has put 21 days complete lockdown, but still some fanatics don't understand that on mid of Janta curfew on 22nd March 20, a few foreigners, out of which 2 to 3 infected of COVID-19, were taken into custody from a mosque in Patna. They were actually given safe haven by the local Muslim populace there to help them in anti-CAA protests. These fanatics don't understand that they are harming themselves and families' life before harming the country's effort to resist this deadly virus. So, on 24th March 2020, the Delhi police did the most commendable job on the very second day of crackdown in Delhi in the wake of this coronavirus. On orders of Delhi Commissioner S.N. Tripathi, it cracked down at Shahin Bagh protest site and removed the 3 months long barricading by the anti-CAA protests. They were actually not understanding. They even didn't met, even left 4 to 5 people to stay there in mid of Janta curfew, which was actually invited by the Prime Minister. So we should at least took the self-motivated step to put the Janta curfew. If people didn't understand it, a few who understood, they came out in the evening and they started putting their thalis outside. The government actually called you, the Prime Minister actually called you to put thalis and to ring bells from your balcony, not means it didn't say you to come out. So the police started late night on 23rd March 20 and cleared Nizamuddin area first. It also cleared protest site from Malviya Nagar, Hojrani, Jafrabad, Turkman Gate and Jamia. So as COVID-19 has been declared a pandemic, since it has spread in more than 192 countries, you can understand the understanding of the stages of COVID-19 uniformly throughout the world is very much required. So the guidelines of WHO in this regard can be understood and followed. So let us understand the guidelines and particularly the stages of WHO about COVID-19. So I will talk about the stages of COVID-19. That is, first stage, it is when the cases are imported into a country in which the infection did not originate. How? I will give you an example. Suppose you land here from a country where this COVID-19 cases are there and you are checked at airport and found symptomatic and isolated there itself. Or it may happen that you are asymptomatic carrier, so you come at home and as a good citizens you do not talk, means you do not get in contact with your family. Also you get quarantine yourself for 14 days and in between you show symptoms, then you call health service and you are found COVID-19 positive. Your family are also checked but they are negative. This case is stage 1. Then I will tell you what is stage 2. Stage 2 is in the second stage, while you land at the airport and you are asymptomatic carrier, you come home and in between you interact with 100 people in your family, in relation, in market, but even the interaction is very less. Then after 14 days you show symptoms of COVID-19. On checking, you and a few members of your family are checked and relatives are checked and people you interacted are also checked, and let's say 5 out of all 100 are found positive. That means it is very much known that you are the carrier, and this is the second stage. Then the third stage, because of it the government of India doesn't want and it want to stop it. So let us understand what is the third stage. It is just like the second stage, just the difference is that the 100 people you met, out of which 10 people are missing and you don't know who those 10 people are. Those 10 people get in contact with a few hundred people. Then those 100 people get in contact with 1,000 of people. Thereafter, a person who has not even contacted you, and it is not known that who is the carrier if he shows the symptoms, and if the trajectory of this case is drawn and the last man at this stage is not found, this is called stage 3. The WHO says community transmission is evidenced by the inability to relate confirmed cases through chains of transmission for a large number of cases, or by increasing positive tests through sentinel samples, routine systematic testing of respiratory samples from established laboratories. And this is called community transmission. In the simplest terms, I gave you the example, and what you can understand is community spread is when you do not know the source of the infection, you are unable to trace it back to someone who has traveled in an area overseas or got it through contact with someone who is infected. Means the last man is not found It is called the community spread. And to avoid this, Indian government has put the complete lockdown for 21 days. Let's see further what happens. Then what is the fourth stage? It is when the disease becomes endemic in some countries and it starts coming year again after year, again after year and year, like meaning they occur round the year across the country. Means as in India there are malaria and dengue, and it is more dangerous. Means you don't understand when it has happened, until you understand and you start giving medicine to the people, already thousands will be dead. So we do not want to spread it to that level. So let us stop it at stage 2 itself. So how does categorizing an outbreak in this manner help? Why I have told you this categorization, why these stages? Because the stages of pandemic are uniform all over the world, as I told you, and the categorization helps countries to take specific action based on the guidelines of WHO that are necessary to target just that particular scenario. Then worldwide, in which stage is the COVID-19 pandemic now? You could see the cases throughout the world. Means I told you that in 192 countries this particular COVID-19 has spread, and it is in the stage of imported cases or local transmission in most of the countries. But in a few countries, you can say that in China, Italy, Iran, South Korea and Japan, it is in community transmission. You can see that this is the China, this is the whole of Europe, and the Italy is here, and it is the biggest hit. Means Japan is here, South Korea is just nearby. Means and you can see that this red dots is spread throughout the map, throughout the globe. Only a few cases are there in Africa. Why it is so? Because the Africa, because of its poverty, is in such a stage that the people live outside and they are very much exposed to so much type of viruses. So their antibody is better than anyone's, means any other country. So that may be a reason, which I assume. Then let us pass the message 5 steps to kicking out coronavirus. So what is this? So I will tell you that especially about this case, as there is a collaboration of WHO and FIFA in wake of COVID-19. FIFA stands for the Federation International de Football Association, which is the governing agency of the football globally, has come forward to help and to cooperate WHO in spreading the words about the prevention of COVID-19 disease. How? That 28 footballers, means very renowned footballers throughout the world from around the globe, have come forward to pass the message to kick out the COVID-19, and at least the people out of love to these footballers will follow the WHO guidelines if these footballers appeal them. It's like passing the ball. So please pass this video, and if you don't pass this video, at least pass the message of the WHO and FIFA. So it's like passing the ball in football. Pass this message to you and your near and dears, and to everyone on social media, and to how to safeguard yourself and kick this corona out of this country. So let us see what are these 5 steps. The first is about your hand. It starts with your hands. Please wash your hands frequently with soap and water or an alcohol based solution. Then cover your nose and mouth with a bent elbow or tissues. When you sneeze or cough, dispose of tissues immediately and wash your hands. Means just understand the coughing or sneezing etiquettes. Use your elbow. Avoid touching your face, particularly your eyes, nose or mouth, to prevent the virus from entering your body. That means this is about your face. Means don't now and then touch your face, eyes, mouth if you are in habit. Then the fourth step is in terms of social interaction, take a step back, stay at least 1 meter distance from others. If you go outside, even if you are contained in your family, just keep a safe distance at least of 1 meter, because this SARS-CoV-2 virus doesn't move more than 1 meter. Then if you feel unwell, stay at home. Please follow all instructions provided by your local health authorities and the WHO. So this 5-step is given by the FIFA and the WHO. So how should India be prepared now? Then the isolation of this means isolation if you are infected, that particular case is called isolation, and quarantine if you are not infected and if you are coming from an area which is actually infected. So the quarantine for you and your family is the only way, and now the government since has put in 21 days complete lockdown, means everybody will be quarantined, and that is only way India can limit the spread of COVID-19, and lockdown is the most important step in breaking transmission of the infection. I support. What about you? Thanks, and please like this video, share, subscribe to the Royals Education. Thanks. Have a nice day.